I take the opportunity of welcoming all our phosphorians for our 149th meet. That is 12 years, 5 months, continuous without a break, except for 3 months due to COVID. This has happened to be our endowment lecture, late Sri M.L. Swamigaru, the founder of Friends on Same Wavelength, my guru and my mentor. For the initial welcome, I take the opportunity and happiness to welcome our distinguished speaker, Professor R.V.S.N. Sarma, who is very well known to all of us. He needs no introduction. He happens to be our vice president of our organization right from the inception of our chapter. He has been of great advice to us. I take the opportunity of welcoming him. He's a highly qualified medical man with MSc, MD, and double FRCP, Edinburgh and Glasgow. And I call him as a medical encyclopedia. If you ask him any question, in a fraction of a second, he comes out with an answer, whatever you may ask him. Such is his great knowledge in medical. In addition to that, he is a great philosopher, thorough in Ramayana, Mahabharata, scriptures, yoga, philosophy, and whatnot. Tells anything, he is able to grasp. And one of the most properties of his is like to share the knowledge with others, which is a great qualification in him. Whatever knowledge he acquires, he would like to share with others and participate with them. And he's a great philosopher, and also Adi Shankara's preachers. He is very much into the preachers of Adi Shankara, follows Advaita philosophy. So that means he's a man, all in all, is like that. And such a man has come today, give a lecture on a very important, useful topic, especially for our age group, regarding the prostate and what all you should know about prostate. Kindly listen to him and keep your questions at the end of his lecture. For discussion, he'll be too happy to clarify our doubts. Now, proceeding further, I call upon our Ananda Kumar, Joint Secretary, to introduce our distinguished speaker. Over to Ananda Kumar, please.
Good evening, dear fellow Phospholians. Founder Sri M.L. Swami's endowment lecture is on prostate gland enlargement by our Vice President, Dr. Rachakonda V.S. Sarma. His deep interest and authority on medicine, Telugu and Sanskrit literature and Hindu philosophy are reflected in this professional and social CV already sent. All of you are familiar with his details. Though he migrated to Bangalore, he is connected to us in this borderless world and meticulously keeps his date with us for the endowment lectures. He is a regular speaker for rendering endowment lectures for paying obeisance to Sri M.L. Swamigaru and Srimati Rangamani Amma, our founders. It is appropriate for me to cut short my introduction to enable 43 waiting members eager to listen to him. Topic chosen by him manifests his deep desire to be useful to all in this era of longevity and age-related biological changes. It is a matter of topical interest, if not interesting topic. Over to our friend on the same wavelength, Dr. Rachakonda V.S. Sarma for his knowledge-sharing session. Thank you, sir.
Thank you, Anand Kumar. Now I call upon our speaker, Professor Dr. R.V.S. Sarma to deliver his lecture. Over to Professor Sarma R.V.S.
Namaskar. A hearty welcome to all the participants of FOSWL Nanagar chapter and other chapters, and also to those wonderful friends of mine in my Ajhan Bharati group and other groups also. Let's start with a prayer to the Guru of the Gurus, the Paramaguru, the Paramatma. Shastram Shariramimansa Devastu Parameshwarah Acharya Shankaracharya Santu me Janma Janmani. Needless to say that all my gurus, teachers in my medical career and in my student days are responsible for what I am. My sincere, humble obeisance and adorations to all the teachers who have contributed to this life. So now, let's talk about the prostate. This, as has been already emphasized several times today, is an endowment oration of Sri M.L. Swami Garu. This is presented from the FOSWL Chennai Annanagar chapter. So I titled this talk as Understanding Prostate Health because we want to be in health and not in disease. That's why what is prostate health, how it can be deranged, and how do we go about understanding this very important topic, particularly in the elderly. This slide is to make you familiar with the person who is speaking. Most of you are very familiar with me. For those of you who are not, these are some of the credentials I have and the responsibilities I hold in various institutions. As has been said, the motto is to impart whatever is imbibed. So you can see here the website there, www.drsharma.in, wherein most of the presentations are available. And on the YouTube channel also, you can secure me in different presentations. And my mobile number for any consultation, of course, it is very free and welcome. 93805-21221 is my mobile number. Please make a note of it. 93805-21221. So now, you require to know what is this prostate. Both men and women, both require to know it. Though it is a gland present in men, women also do like to know it because they require to know something about prostate health of their brothers, of their spouse, of their children, of their parents, whoever it may be. Likewise, problems of women like breast cancer should be known by all men too, because we require to take preventive action and guide ourselves into better health. So that is the importance. It is not gender alone that is important to go through this lecture. As you can see here, there is a tiny little bladder is there. This is called the urinary bladder. I am drawing with the red pen. You can follow that. Below that, there is a walnut-shaped, walnut-sized gland, which is around 20 grams, around 3.5 centimeters in its diameter, 3.5 centimeters in the diameter. And this is the urinary passage or urethra of the male members. So this gland is around the urethra. It surrounds the urethra. And this particular gland is responsible for producing secretions called the prostatic secretions. This fluid from the prostate is important to propel the sperms because the semen as such is a thick fluid coming from the testis, and it is supported by secretions from the seminal vesicles and also the secretions of the prostate. So much so the sperm that we call the liquid that comes out is liquid enough to move through the passages that are required to go through. So this is the function, normal function of the prostate is to liquefy the sperm and see that the sperm is ready for ejaculation. So this prostate gland, normally it grows from a child until 20 years and attains the adult size by about 20 years. So what happens from then onwards, it is quiet. And from the age of 40, again, it starts growing. Mid-40s, it starts growing. So what happens if it grows? This is the urethra in the center, and this is the prostate gland. And this prostate gland, if it impinges on the urethra, by enlargement, it narrows the passage so much so many urinary symptoms are created. So prostate being around the urethra, it is in a position to constrict the urethra or narrow the urethra, so much so the flow of the urine contents are affected. So that is the main problem. Okay. Now, there are 4 conditions which are commonly medically spoken of. You can know what is called the BPH. The doctor will tell you you have got BPH. What is BPH? Simple, non-cancerous, benign enlargement of the prostate is called benign prostatic hyperplasia. Okay. Suppose the prostatic hyperplasia is there. This is the urethra. This is the prostate gland around that. And if it is not compressing on the urethra and simple hyperplasia, there are no urinary symptoms. Supposing it compresses the urethra and the urethra itself is narrowed, it produces what is called, now the urethra is narrow, you see. The narrowed urethra you call what is called BOO, that is bladder outlet obstruction. This is the outlet of the bladder. This is the urinary bladder. This is outlet. The outlet of the bladder is obstructed. It is called bladder outlet obstruction or BOO. Doctor may write BOO. Okay. This prostate enlargement is also graded as grade 1 to grade 4. Needless to say, grade 4 is a larger enlargement. Sometimes what will happen is the gland may not be enlarged, but it can get infected. And that is what is called the prostatitis or inflammation of the prostate. Sometimes what will happen, the enlargement is there and this becomes cancerous. There will be nodularity. There will be coarse nodule-like things will form. Bumps like things will form. And that is what is called prostate cancer. These nodules may be single or multiple. So how many conditions we have? 1, benign prostate hyperplasia. 2, BOO, bladder outlets obstruction. 3, prostatic inflammation or infection. And then 4, prostatitis, prostatic cancer. Each condition affects prostate in a different way. BPH is the commonest, by far the commonest of all these things, particularly in men above 65, is BPH. What is B? Benign is non-cancerous. The word itself is non-cancerous, non-dangerous. That is why English benign means very, very gentle. It is not harsh on the body. Benign, gentle enlargement, non-cancerous enlargement. P stands for prostatic, related to the prostate gland. And H stands for more cells than normal in the prostate. That is called hyperplasia. Benign prostatic hyperplasia. The cells that are affected in hyperplasia are one type of cells are called the transitional cells. Transitional cells. Okay. Remember, the cells that are affected in BPH are different from the cells that are affected in the same gland in cancer. In the cancer, the affected cells are peripheral cells. The peripheral cells are affected in case of cancer. Transitional cells are affected in case of prostatic hyperplasia, commonly known as enlarged prostate. Many a time you get an ultrasound done and you will have a sort of a report saying there is an enlargement of the prostate. They may say grade 1 enlargement of the prostate, grade 2 or something like that. I told you the approximate size is around 1.5 inches or 3.5 centimeters in its dia. Okay, benign prostatic enlargement or hypertrophy can lead to bladder outlet obstruction, as I have shown you in the previous slide, which can cause BOO, bladder outlet obstruction. This results in what are called the lower urinary tract symptoms or LUTS. Doctor may write in his notes BOO LUTS plus. That means lower urinary tract symptoms. What is the upper urinary tract? Upper urinary tract is the kidneys and the tubes connecting the kidneys to the bladder called the ureters. Lower urinary tract is the bladder, urinary bladder itself per se, plus the urethra is the lower urinary tract. Now we are concerned with the lower urinary tract because our front prostate is impinging on the passage of the passage that connects the bladder to the outside, which is called the urethra. So this is around the urethra. That is why there are lower urinary symptoms. Now, BPH, is it related to prostate cancer? Can a BPH turn into prostate cancer? Many of the questions are usually posed. BPH is not prostate cancer. It is benign prostate hypertrophy. This does not cause prostate cancer because this is cell is transitional. In prostate cancer, the cell is a peripheral cell. That is a separate cell. So a person can have BPH and also have cancer in the peripheral cells. BPH symptoms are very similar to those symptoms of prostate cancer. BPH may coexist along with prostate cancer. Now you will be commonly hearing one test called the PSA test. What is PSA? It stands for prostate specific antigen. PSA is prostate specific antigen. A particular blood molecule which is called an antigen, which is specific to the prostate, is called prostate specific antigen. These levels go up in case of BPH and also in prostate. And this PSA cannot distinguish BPH from prostate cancer. Somebody comes with, let us say, the normal BPH, prostate antigen level are 4 unit international units. This is the upper cutoff limit. Somebody has got, let us say, 50. Oh, it is raised. It may be cancer. No. It need not be, or it can be also. The elevation of PSA alone is not a marker of cancer. Don't be worried if your prostate specific antigen is elevated just like that. There are some certain reasons why it gets elevated. So as you see here, this is the prostate there. This is the urinary flow. Outflow is there, the urethra, and the urine is coming down. This is a normal prostate. In cases of hypertrophy, you see here, the gland is enlarged and the urethra is narrowed, the passage is obstructed, urinary outflow is obstructed, BOO is present, lower urinary tract symptoms or LUTs are present. Prostate enlarges, pressure can put on the urethra, it can put pressure on the urethra and cause urinary problems, also called the lower urinary tract symptoms or LUTs. Prostate size does not correlate with the degree of the obstruction. That means this is the urethra. Suppose the gland is enlarged outward like that and nothing doing to the urethra, then there may not be any symptoms. Versus another person, this is the urethra, the prostate is only small enlargement and that is compressing the urethra. Then though the size is smaller, it can produce symptoms. The size does not correlate with the severity of the symptoms in general. So there are two components in the prostate. One component is which is anterior or to the front side. One component is called the posterior or the back side of the urethra, which is in front of the urethra and which is behind the urethra, which is to the front side or abdominal side of the urethra, which is to the back or the spine side of the urethra. It can be either front side or back side, which is called the anterior lobe or the posterior lobe. Okay. Now, what are the symptoms of benign prostatic hyperplasia? What are the symptoms? Patient may have frequent urination during day or during night. There may be a sudden urge to urinate. This is called precipitancy. Burning may be there. There may be painful urination. The flow may become very weak compared to what he was in his adult life. And sensation of the bladder that it is not completely emptied. He feels that still some more urine is remaining and bladder sensation is still felt, or total obstruction can be there. Inability to urinate, also called the retention of urine, or there may be trouble stopping the urine or starting the urine flow. This is called hesitancy in medical words. I have not put the medical words but purposefully not to confuse you. What is the day frequency, night frequency? Polyuria during night, polyuria during the day. Sudden urge to urinate, precipitancy. Burning and painful micturition, dysuria it is called. Weak urine flow, the stream is reduced. Bladder sensation is still felt even after urination. Inability to urinate, retention of urine. Trouble stopping and starting, hesitancy of the urine. So these are some of the common symptoms. Remember, if any one of you or your friend has got these symptoms, immediately they must get checked with the doctor so that they will examine the prostate health. So what are the symptoms? Once again, frequent urination during day or during night, the normal. Normally we expect 3 times during the day or 4 times, nighttime at best once. If it is more than that, you should be worried. Number 2, sudden urge to urinate. Number 3, the urination is painful and burning. Number 4, the stream is weak. Number 5, incomplete sensation of emptying. Number 6, it is inability to urinate or retention of urine not coming at all. And finally, hesitancy and precipitancy can also be there. Now, does it affect the quality of life? Certainly, if I have to go for urination every 2 hours or 3 hours due to my prostate, naturally my quality of life will be affected. Up to 95% of the men with moderate symptoms are unhappy and don't want to spend the rest of life with these symptoms. 51% of the men say BPH interferes with one aspect or other of their daily life. 49% of the men experience sexual problems also associated with the lower urinary tract symptoms. Because of the burning, because of the pain, they may not have good sexual life. And then BPH also affects men's partners' quality of life also. Needless to say, the partner also is affected by a prostate enlarged partner. Okay. Now, what are the quality of life limitations? Limited fluid before bedtime. He cannot take more water. He has to avoid places without toilets. He should limit the fluid before travel, and he's not getting enough sleep because of getting up. Cannot drive for more than 2-3 hours because he has to stop for urination. He has to avoid theater, movie, or workplaces or worship places because of the urinary problems. He has to avoid outdoor things. Among them, the most common problems are listed here. So this is about the BPH and quality of life. Now, who can get BPH? Anybody can get. Men, especially above 50 years, 50% of them. 40 to 50% of men aged 50 to 61 years, they have prostate. 80% of men over 80 years, they have prostate problem or the BPH. What are the common risk factors? Obesity, higher body mass index, lack of exercise may increase the risk for BPH. So, in general, men above 50 years, more so those who are above 65, and sure that above 80% of the people will have prostate problem. So if your body mass index, the BMI and the obesity is there and you don't exercise, you have a tendency to develop BPH. Now, how can this be diagnosed? By the history alone, because just now I told you the points in the history, the lower urinary symptoms, the obstructive symptoms, the BOO symptoms I have told you. So other than that, medical history will be negative except the urinary symptoms. While examination, we examine for the prostate. It is not directly available through the abdominal examination. You have to do what is called the DRE. What is DRE? Putting a finger in the anal canal and the rectum and examining. The doctor will examine with a gloved finger the digital rectal examination, which is very important thing when you have a prostate. Because in DRE, we will know whether the enlargement is smooth, soft, or it is firm and hard, or it is nodular. If it is hard and nodular, it suggests cancer. If it is soft, it is not cancer. It is non-cancerous BPH. Urinary output testing can be done. Urine flow max, what is the speed with which they can throw the urine, that also will be tested. And also after the voiding, this is the bladder, and then this is the urinary tract. What will be the urine before? It's around 250 ml. So after voiding, we'll again check the bladder, how much amount of urine is remaining in the bladder. This is called the residual urine. The residual urine is less than 30 ml, it is normal. Anything more than that, post-void residual urine, post passing the urine, again the bladder will be checked, urinary bladder, and if it is less than 30, it is normal. Anything more than 30 is residual urine increased. Self-evaluation of symptoms. Can I myself evaluate about prostate? There are several international scoring techniques out there. Just I will circulate the presentation to you. You type this in the Google AUASI IPSS, the scoring will be coming. You can enter your values in the scoring, then you will get an answer at the end and say whether you have prostate problem to be evaluated by doctor or not. This is what is called self-evaluation of prostate symptoms. So how to find out the prostate disease? How to find out the disease? The ways to find out. Prostate-specific antigen testing by the blood. This is one commonly used test whenever any lower urinary tract symptoms are suspected, or whenever the BOO symptoms are suspected, or in elderly persons also who are supposed to have prostate hypertrophy. We do a PSA antigen. PSA is a protein produced by the prostate gland. And this particular protein levels are measured in the blood, and this normally is about 4 international units. Is the normal cutoff value. It should be less than 4. And then what is DRE? DRE is here. You can see the doctor here is trying to put a gloved finger into the anal canal while the patient is lying down. It is not a painful procedure. It is simply 2 or 3 minutes it will take for the doctor to look at the prostate gland by palpating, by feeling it with the finger. And if it is irregular and hard, it suggests prostate cancer. If it is smooth and and sort of soft, it is not prostate cancer. So DRE is a must. Don't refuse DRE. The doctor says, I want to do a DRE to evaluate the prostate. You have to get a DRE done. This is a very important test. Digital rectal examination. Digital is finger, rectal is this part of the anal canal, and then this is the digital rectal examination. Now, prostatitis is another condition where there's an infection or inflammation of the prostate, and this can also produce what is called the increase in the PSA. I told you, not only BPH, prostatitis also can produce increased levels of PSA. Otherwise, there is another common problem is patient had a sexual intercourse, he ejaculated few hours or a day within, and there will be an increased level of PSA. So what we normally advise is before going for the test, 2 days of abstinence and from ejaculation is to be practiced before you give a PSA test. Otherwise, it will be a false positive. Then third thing is prostate cancer itself can produce increased levels of PSA. Usually more than 100 will be the prostate cancer value. And I told you the value of the prostate PSA antigen does not tell whether it is BPH or prostate cancer. BPH enlargement of the prostate gland itself, non-cancerous enlargement, can also produce the elevation in the PSA level. Who can get PSA level increase? 1, prostatitis; 2, ejaculation; 3, prostate cancer; 4, BPH; and 5, age itself, the PSA levels start going up. So age itself is a factor which can increase the PSA levels to 15, 20, like that. So elderly people with a value of around 10 or 15 or 20 need not really worry that they have a prostate cancer. Clearly, factors other than prostate cancer can increase the PSA level. This is the enlarged prostate with BPH around. You can see the enlargement. This is the normal prostate here. Urethra is open and the urine flow is normal. Here the urethra is obstructed and not able to pass the urine properly. The BOO symptoms develop. Now, what are the treatment options I have for a benign prostate hypertrophy? This is not for cancer. This is only for the BPH, benign prostate hypertrophy. Watchful waiting and medical therapies. That is, don't do any surgery, and then watch for the symptoms and give them 2 types of drugs. One is called an alpha blocker. The other is called the 5-alpha reductase inhibitor. 2 types of drugs are very much available and in common use. One are called the alpha blockers. The other are called the 5-alpha reductase inhibitors. Both have different actions. This relieves the urinary symptoms. This decreases the enlargement. A combination of both is usually prescribed by your doctor. What are the minimally invasive procedures? TUMT, transurethral microwave therapy. TUMT, transurethral microwave therapy. Likewise, transurethral laser therapy. Likewise, transurethral resection of the prostate. Monopolar resector, bipolar resector, button resectors, different types. Mostly, you don't have to worry about that. TURP is a procedure which is a less invasive procedure for the prostate enlargement, very commonly offered by doctors to the patients who have prostate enlargement. Now, I have put this in red because This is a new technique called the prostate artery embolization or PAE. Recently, my brother, who is nearing 80, he has got prostate enlargement with lower urinary tract symptoms. And we have not submitted him for any one of the other procedures. We have brought him to Bangalore and did a procedure called prostate artery embolization. Here, the prostate is not touched. This is the prostate gland around the urethra. This is the prostate gland. There is blood supply to that. This blood supply is cut off by giving an injection into the blood vessels. So much so, the prostate shrinks. And after about 6 months, the prostate will be like that without any enlargement, just by doing a prostate artery embolization. So this is a very latest intervention radiology procedure, IR procedure, available in few centers. Those of you who would like to know more about IR treatment for prostate or PAE, please contact me. There is always a large enlargement or a cancerous enlargement is there. Open prostatectomy may also be planned. These are the various things that are available. I'm not going to go into many details of this. The complementary alternative medicines, you ask me whether this herb works or that kashayam works or this particular churnam works or homeopathy works. No, there is no evidence that any of these things have any value, including Indian herbal medicines. So kindly do not fall prey to those your gullible public. People may say, I have a kashayam, or I have a churnam, I have a bhasmam, I have a leaf which will cure your prostate. Don't believe it. There is no authentic information, research-based information about that. This is a caution about non-standard forms of therapy for prostate cancer. Watchful waiting and medical therapy, I show no surgery, maybe no drugs, or may have alpha-glucosidase inhibitors or 5-alpha reductase inhibitors. One of them may be given. The alpha blockers, if you give, they are very good drugs. They reduce the urinary symptoms, but there are a few side effects with all medicines. These side effects are around 2%. Maybe they may develop the side effects. So we have to be aware of those things. Then 5-alpha reductase inhibitors, these reduce the size of the prostate and they reduce the need for prostate surgery. And these they relieve the symptoms also. They can be taken as directed by the physician. And again, the side effects are not a big botheration, though the list is there. The side effects are less than 2%. These are the two classes of medicines that are available. One is the alpha blockers. The other is the 5-alpha reductase inhibitors. I'm not giving any pharmacological names because you are not going to self-administer these medicines. You will be, of course, prescribed by your doctor. He will give Flodart plus. Okay, plus is that one additional drug. Flodart is one drug. So it's a combination of alpha reductase inhibitors as well as alpha blockers, and 5-alpha reductase inhibitors will be combined usually and given. Okay. Now, minimally invasive therapy, I told you, here we pass some microwaves to the prostate through the urinary catheter placed in the urethra. And again, a few side effects are expected. Minimally invasive therapy, which is transurethral prostatic resection. A superheated thin metal band is passed through the urethra, through the urinary passage to the level of the prostate, and the prostate tissue is cut into small chunks and then removed. This procedure is not a very complicated procedure. It improves the urine flow volume, and also it demonstrated improvement in the prostate volume. It's also shrinks. There are a few problems associated with the procedure also. I'm not going to go into those details of that. Laser therapy is also available. This is also minimally invasive. And I told you, open prostatectomy is only for people who have got a very large prostate volumes. Normal volume of the prostate, I told you, is around 20 ml or 2 grams or the size of 3.5 centimeters diameter. So if it is more than 80 or 100, then it is difficult to do by TURP or any other method. In such cases, prostate artery embolization, PAE, will be a very good alternative for large prostate along with open surgery. Okay, this is all about the benign enlargement. What is benign enlargement? What are the symptoms it causes? And how do you tackle those symptoms? What is the role of PSA antigen? And then what are the various types of treatment options? I have explained to you. Now, we are going to say a few words about prostate cancer. Remember, this is the third commonest cancer among men. This is the third commonest cancer among men. The first being lung cancer, the second being colorectal, that is the large bowel colorectal cancer, colorectal malignancies, and then the prostate malignancies. This is the frequency of the cancers in men. So you have to screen for lung cancer, you have to screen for colorectal cancer, you have to also watch for prostate cancer as one is aging, because this is the third commonest cancer. For that reason, it's important for you to understand some features of prostate cancer also. Prostate cancer starts from the prostate gland. Obvious, the name is prostate cancer, so it must start from prostate gland. Risk factors of prostate cancer. What are the risk factors? Age is the strongest risk factor for any cancer, more so for prostate cancer. 65% of people who are prostate cancers are above 65 years. If you have 100 patients of prostate cancer, 65 of them are occurring in people who are 65 plus. Among the races, Africans are more affected by prostate cancer compared to Asian Indians. Family history, there may be a history of prostate cancer in the brother or father or a sibling, and genetics play a role up to 10%. What is the lifetime risk for me to develop prostate cancer? Lifetime risk, if you live a full life of 100 years, what is the chance of a person getting lifetime risk? 16% is the lifetime risk, and 3% is the death from prostate cancer. Among all the deaths, 3% of the deaths in lifetime death risk is 3% for prostate cancer. What are the factors which contribute to it? Diet, obesity, exercise, lack of exercise are important. And sometimes sexually transmitted diseases like gonorrhea, like, frequent sexual infections, syphilis, and other sexually transmitted diseases. These are the risk factors for prostate cancer. What are the symptoms of prostate cancer? They're same like BPH only. A prostate cancer may not produce symptoms in majority of the cases. In general, what happens is in BPH, the enlargement is very big, and then they will have symptoms very early. Whereas in case of cancer, the enlargement may not be that big. There may be mild bulge, but there are nodules inside, and these may not produce symptoms at all initially. Later on only they produce. So the size of the enlargement wise, it is not very big in cancers, but it is nodular, rough, and also it is hard. So a man can look healthy by outside and feel fine and may not have any problem, but he may have prostate cancer. So what are the symptoms that if at all he is symptomatic, what symptoms can occur? Blood in the urine, which is not there in the BPH. Need to urinate frequently, particularly night time. Okay, weekend interrupted flow is a common thing for both. Pain or burning while urinating, inability to urinate, regular low back pain, pelvis and upper thighs. So these are extra symptoms. Regular pain in the low back, pelvis and upper thighs, and also blood in the urine are additional symptoms for prostate cancer, in addition to the symptoms of lower urinary tract obstruction. Okay, you got some of the idea about the symptoms of prostate cancer. Can I screen for prostate cancer? Can we take general public and test everyone PSA? And then those who have elevated PSA do the other tests? No, this particular universal screening is not recommended, because there is a beautiful task force called the United States Preventive Services Task Force, which gives guidelines for cancer screening all over the world. USPSTF it is called, United States Preventive Services Task Force. This task force has recommended against the PSA-based screening for prostate cancer, because if it is negative, you cannot exclude cancer. If it is positive, it could be due to prostatitis, it could be due to ejaculation, it could be due to age, and it could be due to BPH itself. So routine screening of PSA is not done. But somebody has got symptoms, somebody has got blood in the urine, somebody has got low back pain, pain in the thighs, pain in the back of the spine. Certainly, yes, you can screen them with ultrasound, ultrasonography of the abdomen, and also do a PSA, not as a routine screening for everybody. USPST decided that the expected harms outweigh the possible benefits if you do it as a universal screening. It is not advocated as a universal screening, but in individual patients, certainly it has got its role to play. There are no exceptions to the recommendations, either due to race or no, this patient is elderly, universal screening for everybody above 65. Shall I do? No. Even if age is higher, there is no role for universal screening. But opportunity screening means whenever they have the symptoms of prostate cancer as listed in the previous slide, then certainly we can do an opportunity screening. It is called not a universal screening. Okay, can prostate cancer be prevented? Can I prevent prostate cancer? It is not known yet how to prevent any cancer for that matter, particularly prostate cancer. Lung cancer, yes, if you don't smoke, if you don't live in an environment which is air pollution, maybe you can avoid lung cancer. Okay, certain cancers are preventable, whereas this cancer, we don't know as yet what are the mechanisms involved in prostate cancer. We don't know as yet how to prevent the cancer. Having said that, there are key behaviors of cancer prevention, such as don't smoke, eat healthy diet, less carbohydrates, less salt and less of the sugars. Okay, SOS, salt, oil, sugar. Salt, oil, sugar. The less we consume, the better we will be enjoying a positive health, particularly in terms of cancers. Be regularly active. Choose to move. At least 45 minutes of brisk walking should be done, preferable if you can do some aerobics. And then maintain your healthy weight. That is the BMI, body mass index, should be kept below 25. So this is ideal weight. How do I know my ideal weight? If your height is 160, your ideal weight must be minus 100, which is equal to 60. If your height is 170, minus 100, 70 is the ideal weight. If your ideal height is 150 and your ideal weight you want to know, remove 100, you get 50. So the height minus 100 is the ideal weight. So one should strike a balance to keep the ideal weight. This is the rule of thumb without doing much calculations. Height minus 100 is the ideal weight. Now, these help to reduce the risk of many types of cancer, including risk for heart disease, including the risk for diabetes and stroke. So follow this early behavior. If you're a smoker, quit. Non-smoker, bless yourself. And then healthy diet, physical activity, and healthy weight maintenance are essential for better living. Now, these are the various references. 17 international references have been used to prepare this presentation. Those of you who are interested to read further, they can medically qualified, they can read. Non-medical people can ask your doctor for help in case you have any of the symptoms. So with this, I'm going to close my talk because I'm given 45 minutes to talk, and I think I have just used the time. And I want whatever remaining time is available, the 15 minutes or whatever it is, I would like to use for discussion so that any questions can be answered. What did we cover? We covered what is prostate, what is the normal size, when it will be increased, what is prostatitis, what is benign prostatic hypertrophy, and what are the symptoms of benign prostatic hypertrophy, what are lower urinary tract symptoms, and then what are the treatment options available for benign prostatic hypertrophy, the non-invasive medical treatment, minimally invasive, and open surgery, versus also the prostate cancer. How does it differ from benign prostate hypertrophy? What are the lead symptoms of prostate cancer? How do I prevent prostate cancer? These things have been answered. I purposefully not touched the treatment of prostate cancer because that is beyond the purview of a general public. If somebody has got prostate cancer, certainly there are many new forms of treatment which you will be discussed by the doctor who are treating you and then please go and heed to their advice and then get yourself treated. If any one of you have any prostate problems or prostate related problems, or if you feel that you have any of the symptoms that I have listed here, or if you do a self-assessment scoring and find yourself in a high risk of prostate enlargement, please contact me. I'm here to help you free of cost. And the idea is here to spread the awareness, to spread the message about prostate health in this particular thing. Now, my brother, the founder, president of this FOSWL Ananagar, Dr. Sharma, is instrumental in bringing me here to this talk. I thank him immensely. In addition to that, all the office bearers like, Narayanan and Ananda Kumar Garu and all other office bearers, Sundar Raman, all other office bearers of the prostate, now of the organization FOSWL and the members of the FOSWL. I thank you all for your patient listening and also for attending in good number to listen to this very important health topic for all of us. Thank you very much.
What a wonderful lecture, Sarmaji. Such an informative and what a lovely clues you have given us. Excellent. Before wasting my time, I'll call upon our audience to bring out their doubts, questions regarding discussion.